Hello, Emma. Could you explain the biliary system to me?
Sure. The biliary system is a crucial part of the liver's function in the human body. The liver is the largest gland we have, and it produces a fluid called bile. This bile is created in liver cells and contains bile salts, bile acids, bilirubin, and cholesterol. It's quite thin and has a golden yellow color. Bile serves both as a secretion, which the body uses, and an excretion, which removes waste products.
What exactly does bile do in the body?
Bile has two primary roles. As a secretion, it provides bile acids necessary for the emulsification of fats, which helps in their digestion. As an excretion, it helps in getting rid of waste products like bilirubin and cholesterol by excreting them into the bile ducts.
How much bile does the liver produce daily?
The liver produces about 1 liter of bile each day. This bile is then transported out of the liver through bile ducts.
Can you describe the structure of the bile ducts?
Of course. The bile ducts are categorized into intrahepatic and extrahepatic ducts. Intrahepatic ducts are located inside the liver. They start as bile capillaries between liver cells and merge to form interlobular bile ducts, then segmental bile ducts. These segmental ducts further combine into two main ducts, the right and left hepatic ducts.
What happens after these ducts leave the liver?
The right and left hepatic ducts exit the liver at the porta hepatis and join to form the common hepatic duct. The extrahepatic ducts start with the common hepatic duct, which is about 3 to 5 centimeters long and travels in the hepatoduodenal ligament. An important branch, the cystic duct, leads to the gallbladder, allowing bile to flow in both directions, into and out of the gallbladder.
What happens when the common hepatic duct and cystic duct merge?
They form the common bile duct, or ductus choleticus, which is about 8 centimeters long. This duct continues to the major duodenal papilla, where it joins the pancreatic duct and empties into the duodenum.
What changes occur if the gallbladder is removed?
When the gallbladder is removed, a procedure known as cholecystectomy, the cystic duct is no longer present, and the common bile duct is referred to as the hepatocholecticus.
Can you explain the variability in the biliary system?
Yes, the biliary system can vary significantly among individuals. For example, about 60% of people have a classical anatomy of intrahepatic bile ducts. However, others might have trifurcation where the right, left, and quadrate ducts enter the common hepatic duct separately, or unique ducts for certain liver segments. This variability is important to know, especially before surgeries like gallbladder removal, to avoid accidentally tying off important bile ducts.
How do doctors visualize these ducts before surgery?
There are several methods to image the bile ducts. Endoscopic retrograde cholangiopancreatography, ERCP, and magnetic resonance cholangiopancreatography, MRCP, are common techniques used to understand the biliary anatomy before operations.
What about the extrahepatic bile ducts during surgery?
The relationships of the extrahepatic bile ducts to nearby blood vessels are very important during surgery. For example, the cystic artery, which supplies the gallbladder, must be carefully managed. There's also a known anatomical variation called Jortso's crook, where the right bile duct loops around the middle segment of the portal vein.
Are there any other important variations to consider?
Yes, the cystic duct's point of origin can vary. Sometimes it arises close to the right hepatic duct or has a deep origin, looping behind the main bile duct. Understanding these variations is crucial for surgeons to avoid complications during procedures.
Could you explain the structure and function of the gallbladder?
Certainly. The gallbladder, or vesica is a muscular and hollow organ shaped like a pear, measuring about 8 to 12 centimeters in length with a capacity of approximately 50 milliliters. It's situated in the fossa vesicae of the liver.
What are the different layers of the gallbladder?
The gallbladder is composed of several layers. 1. Tunica serosa *. This is the peritoneal covering of the gallbladder, consisting of a single layer of flat epithelial cells. 2. Tela subserosa *. This layer of connective tissue lies beneath the serosal epithelium. 3. Tunica muscularis *. The muscular layer of the gallbladder wall. 4. Tunica mucosa *. The mucous membrane of the gallbladder, covered by a single layer of columnar epithelial cells. 5. Plicy-mucosi*. These are mucosal folds that create a ridged appearance.
What are the different parts of the gallbladder?
The gallbladder is divided into three main parts. 1. Fundus vesicae biliaris*, the bottom or fundus of the gallbladder. 2. Corpus vesicae biliaris*, the body of the gallbladder. 3. Column vesicae biliaris*, the neck of the gallbladder, which connects to the cystic duct.
What is the function of the cystic duct?
The cystic duct connects the gallbladder to the common bile duct. It has a spiral fold known as the plica spiralis, which allows bile to flow in both directions, but can also hinder the passage of gallstones.
How does the neck of the gallbladder function?
In the neck of the gallbladder, bile is concentrated by absorbing water. However, this can sometimes lead to the crystallization of certain elements in bile, such as cholesterol and bilirubin, forming gallstones.
What happens when gallstones form?
Gallstones, or concretions, can vary in size. Small stones may travel through the cystic duct into the duodenum and be expelled from the body. However, they can also get lodged along the way, causing intense pain known as biliary colic due to spasms of the smooth muscle. Larger stones often cannot pass through the cystic duct, leading to obstruction, gallbladder enlargement, and possibly chronic inflammation.
How is the gallbladder's blood supply managed during surgery?
During gallbladder surgery, critical structures like the cystic duct and the cystic artery must be carefully ligated. The cystic artery typically branches from the right hepatic artery. However, its origin can vary significantly, sometimes arising from the gastroduodenal artery, the celiac trunk, or the left hepatic artery. Understanding these variations is crucial to avoid mistakenly clipping other important vessels.
How does the lymphatic drainage of the gallbladder work?
The lymphatic drainage of the gallbladder follows the bile ducts and eventually reaches lymph nodes along the portal vein, including hepatic nodes, superior pyloric nodes, celiac nodes, and right cardiac nodes. These lymph nodes can be affected if there are issues with bile drainage or if there are accessory vessels running to the liver.
Thank you for listening. If our podcast has been valuable to you, we would greatly appreciate it if you could leave us a 5-star rating and write a review on Spotify and Apple Podcasts, or subscribe, like, and share on our YouTube channel. Your support helps us greatly with discoverability. We hope to see you soon.